Hello and welcome to Yes to You, the Lifeways podcast. Lifeways is the UK's largest team of support professionals who provide support for adults living in the community. In this episode, you'll be learning about why we at Lifeways believe that community settings, such as supported living services, and not private specialist hospitals, are vital for most longer-term support for adults with varying complex needs. I'm Paul Crompton, Marketing and Communications Manager at Lifeways and your podcast host here, and I'm speaking to Alac Pengelly, our Regional Director for the South Region. Alac is in charge of an area stretching from Kent in the southeast, all the way over to Wales and Cornwall. Alac is one of 7 regional directors at Lifeways, who together run our 1,500 supported living and residential services. Alac, welcome to the podcast.
Thanks, Paul, and I'm glad to be here.
Awesome. So to start with the first question, I understand that you began your career in community-based support around 30 years ago. Is that right? So could you just give us a little bit of career background about yourself?
Well, I was a 19-year-old support worker just as the Community Care Act came into play, which in essence closed long-stay hospitals in the UK and moved them into residential care homes. So I was a support worker then, and between then and now, and I'm over 50 years old now, I've been working in kind of community-based services, whether that's residential care or supported living.
Right, and so for how much of that time at Lifeways then?
The last 4.5 years with Lifeways.
Alac, how would you describe your job in very, very simple terms?
I would say that I'm overall responsible for the regulation of care homes, supported living environments and supported living offices, coupled with making sure that the services are of a high quality and kind of make some commercial sense for Lifeways as an organisation.
Right. And moving back earlier in your career, at what point did you notice that the kind of model of private specialist hospitals wasn't as effective generally?
I think very early on, part of the training I undertook, I had the opportunity to go to different hospitals and see what was actually happening, coupled with reading about events and watching some videos that on Channel 4 that they did an expose of some long-stay institutions. And it was very clear, if you watched the videos or went to the environments, that actually they weren't meeting the needs of the people that were living in those environments. In fact, some of them were quite shocking in how they supported people and how they presented. I think, Paul, could you imagine living with 1,200 people in one building? That's amazing. I mean, that's just be awful, really. I think in reality.
Absolutely, that really doesn't sound pleasant. And what's your, aside from just your own personal kind of lived-in experience, what's your evidence base for belief that more adults need support in less restrictive, sort of community-based models?
Well, I think if you look at any of the kind of stats the government has recently published, the community of the long-stay hospitals has actually increased over the last 10 years, really, and it continues to do so now. The use of physical intervention is quite high in kind of long-stay hospitals. The use of medication to tranquilize people, to mask behaviours, has increased in the last few years. So the reality is, if people are given choice and the ability to choose their environment that they live in and personalize it to their own kind of desires or wishes and needs, then the behaviors that we experience will decrease. Again, if we can imagine being in our own house or living environment and not being able to be given choices for food, whether you can go out and get a paper, whether you can go out to the cinema and without going through quite a lot of kind of hassle in making those personal choices that we all make every day of our living lives.
And are there cases where private specialist hospitals are the right setting for adults with particularly complex needs? Or do you believe that these facilities should be mainly only, say, NHS-led and only in extremely specific circumstances, or at all?
I think there are always cases when people need a short-term intervention, but a short-term intervention should be 3 to 6 months with a discharge date at the end. It shouldn't be the case that someone can move into a long-stay hospital because they are ill at that point, and then 5 years later that they move out. If you, as an individual, went into hospital and were living there 5 years later, for example, then surely that would be a unique experience. But it happens with people with learning disabilities and long-term mental health conditions quite regularly, and probably too regularly.
Right. And although this definitely isn't a pandemic-themed podcast, do you think the events of the pandemic over the last couple of years have led to any kind of change in the way that we think about people living in a proximity to each other? So, for example, for the benefit of our listeners, I'm of the understanding that out of almost 4,500 people we support, not a single person, mercifully, has passed away as a result of contracting coronavirus. And a large part of that could very well be that most of the people who live in Lifeways services are in their own home and not in a larger residential service, which obviously in some cases prove to be hotbeds for infection. So is there kind of, I don't know if that question is relevant, but is there kind of that sort of shift away, if you like, from larger facilities in any case?
I think if you live in a large group setting, then there is always going to be a chance to pass on any kind of contagious disease. With COVID, then you would have a better chance to catch it if you're living in a group setting. If you're living in a small flat, kind of with the relevant support going in, kind of being given to you, then you will be in a better position to fend off any kind of contagious disease, really.
Right, but of course we know that in many cases, group settings are a great form of support for individuals, right? So do you think we're likely to see, if you like, a lot sort of smaller group settings moving forward in cases where there are residential services?
I think residential homes will kind of become smaller as time goes on, yes, particularly for people with learning disabilities. The commissioning patterns that we see, generally speaking, local authorities and CCGs don't like to see homes much bigger than 6 or 7 people at the biggest. And they are for people with a particular set of needs that maybe can't be met in a community setting in a normal street, and needs to have a residential care home of some description. But that is, again, still an exception rather than a rule. Right.
And could you, again, for the benefit of our listeners, describe, we know that every single person is unique, but could you perhaps describe some commonalities of people that we support? So I'm talking, for example, their backgrounds, their needs, their ages, where they come from and where they're going.
Typically, someone would be of adult age, so meaning anywhere between 18 to 65, would have a diagnosed learning disability, so therefore funded through social services for kind of, they might have some autistic traits within their needs, and would just need help with day-to-day living and day-to-day kind of accessing the community and work and college.
So in your region, very roughly, what percentage of people live in supported living services, which I would also include shared houses in that category, and what percentage live in residential services, roughly?
80% of supported living and 20% residential care.
Right, okay. And just to break it down a little bit further, within supported living, what percentage would you say of people have entirely, for example, they might have a whole house to themselves, and what percentage of people or a purpose-built flat or versus people living in shared houses?
I would probably say 70% have their own 1-bedroom flat, 2-bedroom flat, and the rest would have some kind of shared accommodation of some description. The people that have a shared accommodation would have, they would have had a choice about who they live with as well. So it's not a case of there is a bedroom here and you don't get a choice of who you live with. There would be a discussion and compatibility assessment about whether people can live together.
Right. A lot of the people we support that I've had the privilege of speaking to, a lot of them say, for example, I was speaking to someone the other day who's maybe in their 20s or late teens, and they're moved into their own flat with Lifeways. And it's one of these, it's a brand new flat. I mean, they are the first tenant to ever live there. And they're absolutely having the time of their life with the independence that they need and the support when they have it, and really very much a sort of best of all worlds. So, I mean, it's great to see all these, if you like, new build flat schemes coming up, which Lifeways supports. And is this a trend that we're likely to see continue? I mean, is this trend under threat with, for example, rising costs of construction, possible shrinking council budgets? Is this positive development likely to be squashed?
There is always a possibility of those developments not coming to fruition. For example, we've just worked with Portsmouth Council to commission a 28-bedded, well, I say bedded, it is flats, scheme in the city limits. And that's great. But that development, we've got to realise, cost £6.7 million. So to replicate that across in other areas, that council has got to attract the investment and have the desire to put that kind of scheme in place. So therefore, with shrinking budgets, with rising construction costs, of course, there's going to be a degree of kind of resistance, or not resistance, actually. Are people going to be able to afford to do it? That's the question. And the answer to that question is probably, in the next few years, probably not in some cases, which is going to be a real shame for some people that we will be supporting, because the modernisation of social care needs to continue, whether it's through kind of a period of growth or a period of where we're shrinkage for councils. So it will be really interesting to see what happens with that. And yeah, I mean, I think this kind of a watch this space kind of moment, isn't it, really, and see what happens.
Let's hope it's positive. A saying I recall reading from former NHS England chief Simon Stevens was, "Think like a patient, spend like a taxpayer." And how do community-based settings fit within that mantra? I mean, is this a much more expensive way to do support? Is it a much cheaper way? And most importantly, we know it's an efficient way. We know it's an effective way, but how does it work in terms of costs for local authorities?
I think if we look at how supported living is paid for, the kind of cost of the accommodation is taken out of someone's support package. So the local authority pays purely for someone's support. So if someone requires 100 hours of support, then a local authority pays for that. How an individual then accesses kind of rent and living expenses is through the normal benefits process that you or I would go through. Within a specialist hospital or residential care setting, then what we're looking at then is around an average spend for a local authority or CCG of £3,000 a week for someone's kind of needs, but that includes their hotel or their kind of living expenses. So in reality, a supported living environment will always be cheaper than a residential care home or a specialist hospital.
Right. When you say hotel expenses, just to clarify, you mean, for example, gas, water, electricity, internet, and so on and so forth?
Yeah, and just general living expenses.
Right. So what makes supported living so much cheaper, and also how much cheaper, very roughly?
Probably out of a £3,000 a week fee for a specialist hospital, then a supported living environment would probably be maybe £1,000 cheaper a week, based on, depending on someone's support levels in the very first place. How is because it allows someone with a learning disability to access benefits that you or I could access if we didn't have or we weren't employed. So their living expenses would be paid through the benefit system, and the local authority then pays for the support that someone kind of has or needs to have to enable them to live their lives.
To move on more about effective support, can you talk or give some examples of people that people we support that you know and have worked with, of really just success stories, people who have perhaps come from private specialist hospitals to a Lifeways service, or people whose lives have just really been able to be turned around as a result of moving to a less restrictive, more independent mode of support?
I think there's a few. A gentleman I used to work with a while ago now. He was admitted into a service that was part of the portfolio that I worked with, and the gentleman in question had some very high level needs, particularly around self-injurious behaviour. And working with kind of the PBS team at the time, we were able to identify why the gentleman exhibited some of the behaviours that he did. And so in terms of frequency of incidents, he went from probably 10 to 15 incidents a day to probably 10 a month. So, and the environment that he worked in, lived in, but was tailored to meet his needs. The support workers were trained and tailored to meet his needs. Where in a potentially in a specialist environment, you have kind of some support workers and nurses that are employed by the hospital and not necessarily kind of tailored to meet someone's kind of needs, and indeed sometimes interviewed by the person that we support. In that particular case, obviously, the gentleman couldn't be part of the interview, but their advocate and their kind of next of kin was involved in interviewing on occasions and when they could. So they had a really good idea of the person and the type of person that would successfully be able to work with the individual.
Right, and without descending into a sort of psychobabble, to what extent does it work that, for example, when we are in hospital, we may, as well as actually being a patient, in fact, we may also kind of role play being a patient. Equally, when we are in a hotel, we may sort of role play being a guest. If you get the drift of what I'm trying to say here, to what extent does that just idea of putting someone in a more positive, independent environment just sort of make the difference in terms of the person's overall well-being and even the way that the person thinks about themselves? So, for example, from patient to, young individual living their life.
I think then people have to be trained in active support, what is called active support. So, a support worker intervenes when a person needs that support rather than on a constant basis. If you're living in a specialist hospital, yes, you might have a one-to-one attached to you to meet your needs. However, it is much more of an environment where you might be living with 10, 15 other people, and there would only be maybe 3 or 4 people on duty to meet your needs. So that support can't be always customized at that point or tailored to meet your individual needs. It's much more of a blanket. You have 4 or 5 people to support 10, 12, 15 people. And it becomes much more difficult at that time to have a person-centered approach in the support that you give. And also, within a hospital setting, you have you are in a hospital, you're admitted to a hospital and not living in your own house. So the purpose of the two settings are different from that respect.
Do we ever, or do you ever, in your meetings with funders and commissioners, do you ever have to, if you like, convince funders and commissioners that the people that they are currently supporting would be better off in a less restrictive environment?
Thankfully, no, not anymore, really, to be honest, and which is quite nice, really. It's because the commissioners that we work with, and over the South, it's quite a few. I think they've seen over the years that kind of a hospital environment isn't usually right for somebody that has a learning disability. And I think that's a key thing. I mean, that's with the change in kind of view, acts of parliament like the Community Care Act and the Health and Social Care Act, and kind of that gives choices to people with learning disabilities, and where maybe at the beginning of my career that those choices weren't there necessarily for people that were in need of support.
I'm somewhat reminded of the politician's joke at this point, where the politician's saying, I need to see where the people are going so that I might lead them. And equally in this case, and I'll clarify exactly what I mean by that joke. In this case, to what extent are private or independent sector providers leading in terms of better, more modern modes of support? Or to what extent are they following? For example, I understand that supported living in the UK came about as a result of a Welsh government initiative. I think was it called the All Wales Strategy in the 80s? So we very much see their government is leading very, very clearly, and the private sector and the independent sector is following. Is that what is, if you like, the lie of the land in England specifically today? Who's sort of, in effect, maybe it's not the right question, but who is kind of leading who?
I think it's actually become, in my experience, in the last few years, much more of a joint kind of perspective from local authorities, CCGs, and private organisations. If for example, if I have an idea around how to support a group of people, and I go to a commissioner and discuss that particular idea, then often that's taken on board and we work together to make that happen. Which is absolutely great. I mean, sometimes that's in a tender forum, sometimes that's as a bespoke piece of work, but it's very much a kind of a place where local authorities, CCGs, and private providers are able to kind of voice their ideas jointly and work on them jointly, which is great. To be honest, it's a much more balanced approach. Government initiatives and council initiatives, I think, will always now, for the foreseeable future, be about bespoke packages of care for people in their own houses. And their own house meaning either a flat scheme such as Patey Court, as I mentioned earlier, or just a house in an everyday street, with neighbours that may not be in receipt of care.
Just to clarify for our listeners, Patey Court refers to the, I believe, 28 flat scheme in Portsmouth that's coming up. Is that right?
Yes, it does, and it's a great it's a great building that provides a high quality environments for people with learning disabilities.
Right. I'm glad that you brought up cooperation, that idea of cooperation between providers and local authorities, because that really brings me to my last question that kind of tinges on this kind of collaboration versus competition spectrum, if you like. How do you think us as providers might work better with local authorities and NHS bodies?
I think there's always kind of discussion, debate within the setting or the area that we work in. And I think it's about providers appreciating that councils have a limited budget to provide care, but councils being realistic with providers around what can be provided for whatever they're able to pay for that service. I think recently I seem to have detected a difference, and I'll give you a really good example. Within the South, we have a project where I want to pay as a real living wage to everybody within the South. And so I've started talking to the multiple councils that we work with, and local authorities, and At the moment, we've got another 3 councils to negotiate with, so our staff receive real living wage. Out of probably 20, I think it is, councils so far. And at the moment, every council that we've approached, after having a meaningful discussion, we've managed to negotiate an increase for our staff teams to be paid real living wage as an absolute minimum, sometimes more, depending on the geographic area. Now, I gave myself 2 years to do this project. In reality, so far it's taken 11 months. But I think that's because of the kind of local authorities willing to engage in the conversation and then realizing actually it's not a private sector organization just increasing their profit margin. It's about reinvesting into the staff team. So I think the reinvestment into the social care sector is still very high on the agenda. And I think councils and local authorities are on board with that journey with the provider sector.
Right, and I'm glad actually that you've brought up also recruitment and wages in your area, particularly as we know the southeast, the region that you cover, has some of the highest costs of living in the country by far, and what with the staff shortage in general across the nation. I mean, how do you feel this is going to play out? Obviously, I'm not asking you to look into your crystal ball, but how do you feel this is going to play out in terms of the sort of the balance between there actually physically being people who are willing to and want to work supporting others, coupled with the money for them to be paid and the money for them to be motivated?
I think over the last few years, with the events that we've seen, and COVID not being kind of the least of them by a long way, then I think the value attached to being a support worker or working in kind of social care has increased. And what I mean by that is that people have realised that actually the kind of workers that do this work are actually valued professional people. Now, if we use that mantra, valued professional people, and then apply it to the salaries that sometimes are paid, then I think local authorities and CCGs are very much aware that, as a sector, we have to increase the offering and rewards to the workers that we employ. And that's a message that I've got in the discussions I've had with the multiple local authorities over the last 12 months. And it's, to me, it's quite reassuring and kind of gives some validation to the sector.
Right. So just distilling from what you're saying, if I've understood you correctly, you're kind of saying that in the last few years, the events of the last few years have made support workers be taken, not to say they weren't taken seriously, but that is to say that to be taken even more seriously than they were before, and their roles. Thus, they're more valued, and being more valued, there becomes more funds and more money directed towards them and paying them. So thus, that sounds like a pretty positive place to be in, right? That we're getting into then. Is that a summary of what you've said?
I think it's a more positive place, yes, and I think that is a summary of what I've said. Yeah, it's good to see after quite a few years of seeing maybe that's not always been the case. I think social care has always been a career that's been meaningful and a vocation sometimes, and with the kind of qualifications that are available to people to take, with the increased value from society and the local authorities, then I'm hopeful that the future of social care will be very much a positive place to be and attract some more highly skilled and kind of people that want to be in the sector and work with the people that we work with in a very meaningful way. So I would say, I have a degree of optimism, but it's always going to be, it's a difficult place. And I think social care is a very place that moves sometimes very slowly. So that evolution will probably be over the next kind of 2 or 3 or 4 years rather than next year. If that makes sense, Paul.
Right, I see. Well, in the words of a famous revolutionary, there are decades when nothing happens and weeks when decades happen. So I suppose we may wait and see. Well, thanks very much for speaking to me, Alac, and it's really great to have your own personal insights, reflections, and insight from all of your time working in social care.
Okay, thank you very much, Paul. It's been a pleasure.
Absolutely. And thanks to you, the listener, for tuning in to this episode of Yes to You, the Lifeways Social Care podcast. We'll be releasing new episodes all about adult supported and residential living every month, so if you haven't already, please do subscribe. See you next time.